Hi, everyone. Thanks for taking the time to join us today. My name is Stacy Fox, and I'm really honored to serve as the president and CEO at the Georgia Budget and Policy Institute. At GBPI, we conduct rigorous analysis and research to advance policy solutions to ensure that all Georgians thrive. Because we envision a state budget informed by the people that improves economic opportunities for all Georgians, creating a just, equitable, and inclusive economy. And what better day to do what GBPI has now been doing for 21 years, explain the state budget in plain language for all Georgians, because today marks the first day of the new fiscal year for the state of Georgia. Next slide, please. Yet this year, a large threat looms in Washington as the U.S. Senate just hours ago passed the budget reconciliation bill that now goes back to the House. GBPI would be negligent to ignore this moment and the tremendous impact these decisions will have on the lives of Georgians. We are monitoring progress and assessing impact in real time, so stay tuned for a fact-based analysis of this bill after the final vote. In this federal bill, healthcare is at risk via threats to Medicaid for approximately 788,000 Georgians who primarily are elderly and children. And did you know that 45% of births and over 70% of nursing home stays are financed by Medicaid? Medicaid is Georgia's largest source of federal revenue. One in every $5 spent by the state comes from federal Medicaid. And despite Georgia's experience with a Medicaid work requirement, the only state with that requirement, and other state-based research that show work requirements do not work, Congress has leaned in with this federal bill and created a barrier for millions seeking health care. Food security is also at risk with threats to SNAP for 1.4 million Georgians, or about 700,000 households across the state. Legal experts even say the state could cease the SNAP program altogether given a federal cost shift. Did you know that 53 of Georgia's 159 counties had more than 20% of their population relying on SNAP just last year? And these cuts do not just affect those Georgians who are receiving this support. It impacts the jobs of healthcare providers, the solvency of rural hospitals, the income for Georgia's farmers and their ability to pay their workers, and the businesses of grocers who sell those crops. For example, the National Grocers Association estimates that at grocery stores alone, SNAP benefits helped generate more than $343 million in grocery industry wages in Georgia just last year. Next slide, please. The tax changes in this federal bill have a disproportionate impact on those with the least resources by leaning into a very regressive tax structure. These proposed tax changes only put more money in the pockets of the wealthy while deepening the stress on Georgians, even in the middle income bracket. Georgians hit the hardest by all of these changes will be people of color living in rural Georgia. And by the way, this Senate package adds $3.3 trillion to the federal deficit. You know, one third, sorry, of Georgia's budget, or about $2.5 billion, depends on federal funds. These dollars help educate our children, feed families, cover healthcare for millions, and support rural hospitals. While Congress proposes cuts to programs like Medicaid and SNAP, it doesn't just reduce line items in Washington. It directly threatens services thousands of Georgians rely on to survive and thrive. And at a time when Georgia sits on the largest amount of state reserves in modern history, $17 billion, the decisions our lawmakers make during legislative session determine whether prosperity is broadly shared among all Georgians or further concentrated among those who have the most wealth. The state has never really been great about meeting the individual needs of Georgians, and the needle has barely moved because adjusted for inflation, spending per capita has only barely increased over the last 20 years. And with federal budget shifts, we are rewinding progress. Next slide, please. And let's talk about who makes those decisions. As you can see here, there are some big gaps in who makes the decisions and who our lawmakers in Georgia represent. Georgia's FY26 budget outlines $67.2 billion in planned spending, drawing from a mix of state, federal, and agency-raised funds. But beneath the placid surface of this balanced ledger lies a turbulent reality. While state revenues have surged, federal investments, especially those that support families with low incomes, schools, and healthcare across the state, are under unprecedented threat. For over 20 years, GBPI has produced this budget primer to educate Georgians about how the state is using their dollars. And this year, GBPI has expanded our scope to include the impact of federal threats. The threats are real, and the surplus would not be able to close an annual gap. Our state is already not meeting the needs of all Georgians and not supporting our shared dreams. And you can find the proof in the pages of our state budget, which we will outline here in our budget primer. We at GBPI cannot do this work without your support, so please consider making a donation to GBPI today. You can find the link on our website, www.gbpi.org, because our mission starts with transparency, showing what is behind the curtain of decisions made under the Gold Dome. And a key tool in that annual pursuit of transparency is our budget primer. So let me hand the mic over to our Director of Legislative Strategy and Senior Fiscal Analyst, Dr. Danny Canso.
Thank you so much, Stacy, and thank you to all of those joining us this afternoon on this very, very busy July day. And so, although there's a lot going on in Washington, which we'll talk about a little bit, how that affects the state. One out of every $3 to the state of Georgia comes from federal spending in the $67.2 billion budget. Today is also the first day of the FY 2026 fiscal year that will run from today through June 30th. So we're excited to share these numbers with you that will affect all Georgians across the state. The budget is the most important piece of legislation that the state passes, affecting all 11 million Georgians across our state. And so if we go to the next slide, you can see the big picture. So $67.2 billion will be spent over the next 12 months. You can see that the vast majority of that, about 56%, comes from state sources, things like the income tax, sales taxes. The next largest source of revenue, federal funds, about 33%. And then you can see smaller sources of revenue, motor fuel funds, which are dedicated to infrastructure, lottery funds that are dedicated to pre-K and scholarships for higher education, and then about $150 million that the state receives from our settlement with the big tobacco companies about 30 years ago. So if we go to the next slide, you can see that the income tax is really the primary source of revenue, the foundation on which the state budget is built on. So about 50 cents out of every dollar that the state will spend of these $37.8 billion in the state budget, 50% will come from the income tax. And the vast majority of that will come from the personal income tax. So about $15.7 billion over the next year, 42% of the budget. There's also the corporate income tax, primarily assessed on larger corporations in Georgia. That will bring in an estimated $3.2 billion, about 9%. And I'll also say that what you're looking at here is the governor's revenue estimate. And so in Georgia, really the central budgetary power that the governor has is being able to set the revenue estimate, which caps the amount that the General Assembly, which is then constitutionally responsible for appropriating funds, can spend. And so as one fiscal year begins today, the last fiscal year ended. And so now we're going to see the state accounting for the amount of funds that were raised, the amount of funds that were spent. And as Stacy alluded to, in recent years, we've had very large surpluses. So the amount that will be added or subtracted from the $17 billion in general fund surplus dollars that are on hand right now. And so through the first 11 months of the year, we're still waiting on data for June. State tax collections were up almost 2%. And so that leads us to believe that although the state budgeted more than those tax collections, as we'll discuss as we go further, that the state will conclude that, concludes the fiscal year with a really healthy amount on hand, probably between 14 to 16 billion dollars. So still near the highest amount that we've ever had in surplus dollars. But for next year, I think it's also important to note that we are implementing a cut to the income tax rate. So it will be reduced from 5.39 to 5.19%, and that was actually effective as of January 1st. So that reduction is already being felt in state revenues. And so it's important because the income tax, being the state's largest source of revenue, 50 cents out of every dollar that the state is raising, we're going to see those revenues reduced by about 4% because of that reduction that was made. So the next source of revenue, which has really been a leading source of growth in recent years as consumer spending has increased, is the sales tax. But you can see that's still only about a quarter of every dollar that the state raises. Also, other taxes and fees, about 14%. In that, one of the kind of areas, the last area that I'll highlight is interest. So the state last year collected over $1.6 billion in interest. Next year, the state is estimating that figure will be lower, about $800 million, but still a really significant amount that's built into this revenue estimate. And that's one of the ways that the surplus is factoring into the budget. And then you can see about 10% are made up of designated fees, the gas tax, the lottery, tobacco settlement funds. And so if we move to the next slide, the way that these funds are spent in Georgia is primarily on healthcare and education. So 73% of the full state budget, $37.8 billion, is spent on healthcare and education. So of that, about 38% goes towards pre-K through 12th grade education, about 14% goes to higher education, about 20% to healthcare and public health in Georgia, about 9% goes to transportation, and then the next leading source of appropriations goes down to criminal legal systems at 7%, and all of the other areas that you see are below 5% of the state budget. So really, healthcare and education make up most of what the state does, and has a very big impact across Georgia on millions of Georgians in that way. And if you go to the next slide, you can see that although federal spending also similarly is concentrated in healthcare and education, a much larger source of federal dollars go towards healthcare. So 61% of $22.5 billion that the state will receive over the next year goes to healthcare. And as the Senate passes this piece of reconciliation legislation, most of those budget cuts are in the area of healthcare. And so certainly my colleague Leah Chan will discuss a little bit of that, and you can look out for more work from GBPI on what that will mean for the state budget in future years. The next largest source of spending would be education, about 23% between K through 12 and higher education, and then about 6% to human services. So really, healthcare, human services, and education are where those federal funds are going, with a little bit to transportation and infrastructure as well. So if we move to the next slide, you can see basically the story of recent years in Georgia is that the governor has really leveraged that revenue estimating authority to set very conservative revenue estimates that have occurred as we've really seen fairly significant economic growth, a really strong rebound from the pandemic, led in part by the strong federal response that we saw. And so those things kind of collided to produce these really unprecedented surpluses. And that trend continues. FY 2025, the fiscal year that ended yesterday, is the first year that we will spend down those general fund surpluses since 2020, and the first year in recent history that we've spent those funds outside of tax rebates on non-emergency spending. So although that's just $2.7 billion, and we expect to see a little bit of a surplus over the governor's revenue estimate that will diminish that somewhat, it is significant. And it marks, hopefully, the turning of the tide and investing those resources in the very real need that Georgians are facing in the next fiscal year, where we estimate that somewhere between $14 to $16 billion will remain between the revenue shortfall reserve and those unrestricted surplus accounts, which are actually now larger, $11 billion now, but that we expect to go down likely a couple $1 billion. So last year, the surplus was about $900 million, and that's what helped to produce this $17 billion cumulative number that you've heard, but likely we'll see that go down a bit as we give out about $1 billion in tax rebates and spend down about $2.7 billion largely on infrastructure projects. And so still, as we look at the budget, we see that FY 2025 was about 4.5% lower than the current year budget. So that is a little bit of growth that will slightly outpace inflation over the next year. So if we go to the next slide. Really, what we've seen in the last year was a very large focus on using recurring dollars for one-time spending. So the AFY 2025 budget included about $6 billion in one-time spending, about $1 billion for that tax rebate, and then primarily distributed through infrastructure. So about $1.6 billion for long-term capital projects, money for the Hyundai project in the Savannah area, money for wastewater grants to local communities, about $500 million for the employer retirement system that may lead to a raise for retirees for the first time in many years, but really a concentration on that one-time spending that has left significant room in the budget as we look to potentially address some of these long-term needs. So when we add things like a tax rebate, like one-time infrastructure spending, as revenues continue to increase, that leaves room that could, as those sources could potentially be paid for with other revenues that could be invested in things like healthcare and education. And I also want to note that the state right now, as we've seen since 2023, a really unusual pattern of financing long-term infrastructure projects with cash instead of using bonds. Now the state's bonding capacity is at its lowest level in modern history. So the state can issue bonds up to 10% of the state budget. Right now, we see just 3.2%. So that is significantly less than the 5% average that we've seen in recent years. And that's another way that we see room in the budget as we look ahead to potentially address some shortfalls that may be being created at the federal level right now. So we can continue. And so I just want to briefly highlight as well the other side of the budget, which is that the state has also, over the last couple of decades, created many tax breaks that now consume a significant share of revenue that we would otherwise collect. So these are specific laws that have been passed, enacted to either exempt certain areas or industries from taxes or to give out proactive tax breaks, tax credits like the film tax credit, which is the largest business tax credit that the state offers, estimated about $900 million over the next year. The state also spends over $500 million on tax deductions and abatements for insurance companies. And then you can see the rest of the list here. And as we add up that kind of constellation of tax credits, it's somewhere around $11 billion in total. And you can also see more in the primer on this front. So next slide. So I highlighted this, but you can just see kind of this stark pattern. And this is just the revenue shortfall reserve. So this account is about $5.5 billion. On top of this, right now we have $11 billion in undesignated reserves. And that number will decrease slightly, but still remains much, much higher than we've seen at any point in our state's history. So that's a really significant opportunity. The minimum reserve amount is 4%. So right now, the state has about 50% in general fund reserves that are available to be spent down. So next slide. So you can see here the undesignated surplus, and you can see kind of just this pattern where 2021 is the first year in our state's history that we filled the revenue shortfall reserve to its maximum, which is 15% of state revenue collections. And now on top of that, again, we are approaching about 50%. And so we are well above what we've seen in recent history, and that presents a really significant opportunity that remains really untapped. So next slide. And now, lastly, I mentioned this, but I think it's really worth focusing on. As we look at the federal level, these really regressive tax cuts that are being enacted, we see something similar at the state level on a much smaller scale. But there also is having a pressure impact on the state budget. Again, the income tax is our largest source of revenue. Half of the state budget comes from the income tax. So although it is relatively minor for most Georgians, most households are pretty unlikely to notice this. Most Georgians, the majority of households will receive less than $80 over the next year. On average under this plan. So we're reducing the flat tax rate from 5.39% to 5.19%. That will cost about $725 million when it's fully implemented, and only 13% of that $725 million will go to the first 60% of Georgia households. You can see that for those in the very very high income bracket, they will see a relatively minor change as a share of their income, but certainly the largest tax credits, the largest tax cuts, and the most noticeable. But this is really a drop in the bucket, a relatively small impact in the most costly way to deliver the lowest tax relief for the most people across our state. So as we go forward, we hope the state will look to other options, which we've also seen, things like the child tax credit, increases in the standard deduction that could be much more impactful. But as we look at this policy, you can see that it really is staggered at the very top. And now, to discuss education policy, I'll turn it over to my colleague, Ife Finch Floyd.
Thanks, Danny. Hi, everyone. My name is Ife Finch Floyd, and I'm the Director of Economic Justice at GBPI. And I'm going to start the education remarks on the Department of Early Care and Learning, or DECAL. Next slide, please. So DECAL oversees child care services, or the Child Care and Parent Services, the CAPS program, the Georgia Pre-K program, nutrition services, which includes the federal child and adult care food program and summer meals for low-income children, and quality initiatives that work to improve the quality and accessibility of our child care programs. The legislature approved about $640 million for DECAL, and that's about a 4% increase from what we saw in the previous fiscal year. The general fund support child care services, or the CAPS program, and the state lottery funds support the pre-K program. So we see here about $77 million of the general funds will support the CAPS program, and about $563 million will support the lottery funded pre-K. Next slide. So let's start with pre-K first. There's an additional $22 million in the budget for pre-K. And just to focus on a few of the highlights, about $14 million to increase for year 2 of a 4-year phase-in to reduce the maximum class size for pre-K classrooms from 22 to 20. And this is really important for pre-K teachers. It allows them to have a little bit more one-on-one time with each student. There's another $5 million increase for an update to pre-K teacher training formula funds. And these additional investments really build on a huge amount of funding that was given to the pre-K program in FY 2025, about $100 million in additional funding for the pre-K program. And that went to pay for salary increases for lead teachers and assistant teachers, making them a little bit more comparable to K through 12 teachers. Also, again, this reducing the class sizes, and then also providing startup grants and operational grants to make it easier for providers and school districts to create and start pre-K programs, as well as supporting student transportation when necessary. Additionally, in the amended fiscal year 2025 budget, there was a true up of about $7.4 million to ensure those pre-K teacher pays were remaining aligned with K-12 teachers. Next slide, please. So in childcare, the fiscal year 2026 budget really only provides a modest increase to the CAPS program. So we see about $1.5 million in the budget to annualize this increase of reimbursement rates to providers. We first saw this in the 2025 budget, and the 2026 budget annualizes this 60 percentile reimbursement rate for child care providers. And this is really important because before, Georgia had been paying or reimbursing providers at a very low rate, and now we are well in line with the federal standard here. There's also about $4 million to cover 500 additional CAP scholarships. Now, this is really a modest investment when we look at the gap that was left after Congress failed to extend the federal relief funding for childcare. With that funding, we saw about 22,000 additional CAP scholarships, if not more, going for families, and also additional enhancements to childcare providers. However, now that those funds have expired, DeKalb is currently rolling back those expansions. So for example, the agency has reduced the initial income eligibility level from 50% of the state's median income, which is about $53,000 for a family of four, to 30% of state median income, which is about $32,000 for a family of four. And that's really the lowest in the country. But that is going to try to reduce those CAP scholarships. So I'll pause there and share or pass it on to my colleague, Ashley.
Hello, good afternoon to everyone. My name is Ashley Young, Senior Education Policy Analyst at Georgia Budget and Policy Institute. Before I begin, I just want to recognize that this year has been incredibly unsettling with the dismantling of the Department of Education. Many school district leaders and administrators, college presidents have had to navigate turbulent education landscape. So I just want to take a moment and acknowledge all of our educators and folks who have devoted their life to helping educate our youth as we send them patience, love, hope, and continue to work hard, continue to honor the hard work that is needed to educate all of our Georgia students. I'm going to start with the Department of Education. Here you see that the Department of Education's budget is generally quite robust, but for the sake of our time, I will just discuss our big ticket items here below. And you'll see here that $910 million of a decrease for the Quality Basic Education Act, QBE. The education grants in particular. And this provides additional financial assistance to local school systems and rank just below the statewide average of the per pupil tax wealth. I would also add here that there's a $6 million increase for QBE formula funds for sparsity grants to help smaller districts pay for fixed overhead costs. We also saw a $2.8 billion decrease for the local 5 mil share. And of course, this is the standard deduction for the total QBE earnings that local school districts are required to cover at least local 5 mil share in property taxes. And then you also see a $20 million increase to replace 227 school buses, which are certainly needed to help with the absenteeism issue in schools. Next slide, please. This year, the General Assembly appropriated nearly $50 million to provide public schools with fundings for student services. This was an amazing breakthrough that we have been advocating for some time at GBPI. So, under that $50 million for student support services, it includes $2 million to ensure that all schools, regardless of their size, have a social worker, and $15 million for a one-time pilot for school districts for economically disadvantaged students. And to be clear, I want to take a moment and just explain, here at GBPI, we are dedicated to ensuring that students who are in poverty have the additional funding that they need. So again, this $15 million for students that are economically disadvantaged is a step in the right direction, but we do want to pause and recognize this as a step and the direction that we are hoping to continue with. Again, $19 million for mental health grants to help with counselor referrals, and then $14 million for other student support services. Keep in mind that many schools in rural areas are vulnerable to low educational attainment and are less likely to pursue post-secondary education. And so having these additional student support services will be super helpful for both mental health and academic outcomes. Again, fully funding QBE is a top priority here at GBPI. Georgia is one of 6 states that does not provide additional funding for students who live in poverty. And again, this $15 million appropriation is a step in the right direction. We do prioritize fully funding public schools, which includes additional provisions for students, again, who live in poverty. Next slide, please. This year, the Georgia General Assembly budgeted $141 million in public funds for the state's latest voucher program, the Georgia Promise Scholarship. And these funds help eligible students and families pay for private school tuition through $6,500 vouchers. It will actually roll out this fall. The voucher program, if you haven't heard already, is in high demand. As evidence in the first 3 weeks, the Georgia Student Finance Commission reported that that there have been around 7,400 applications and will potentially fund over 21,000 vouchers for eligible students. I want to be clear, not only do vouchers drain funding from QBE, but the financial impact is also felt on local school districts level. It's quantified through what we call fiscal externality, and this is a measure of how much per pupil funds are reduced because of an enrollment drop. So if you think about it, just because when a student leaves a school and the enrollment drops in that district, those dollars go with them. So in that first year, the Georgia Promise Scholarship, let's just assume that maybe 20% of the students who obtain the voucher are public school students who leave to attend private schools. School districts will still have to spend between $12 and $61 more per each student who remains to continue to maintain the same level of services like classroom instruction and public school students receive before the voucher students left. So again, not only could Georgia stand to lose the $141 million from the state budget appropriation for the voucher program, but the fiscal externality costs also should raise concerns for public school advocates as we see the federal administration push to expand vouchers. This will only increase as we are seeing this trend. All right, next slide, please. In addition to vouchers, school districts are also navigating the public school threat of property tax caps. In Georgia, local boards of education are authorized to impose, of course, at least $5 per every $1,000, as I mentioned a little bit earlier, of taxable property value. This is known as, again, the local 5 mil share. And local revenues account for about 40% of total public school on average funding in Georgia. It looks different for every school district, but on average, local revenues account for about 40%. That funding will likely be reduced by statewide property tax policies, HB 581 that caps annual assessment increase for property taxes at the rate of inflation. We want to keep a close watch on this. Many of school districts, about 120 systems, have actually taken action to opt out. And again, we just saw the passage of HB 92 in our 2025 legislative session, and schools now have until March 1st, 2030 to confirm their decision to cap property taxes. But this will be up to the school districts and can impact them in many different ways. And we know that local property taxes are important for school districts. Next slide, please. I just want to quickly kind of go through. We've been conducting some research with chief financial officers around the state, and we have uncovered some very insightful information to help clarify this narrative that some organizations have pushed, claiming that schools are flush with cash and that they have excessive unassigned reserve fund balances. So far, we know that even though some school districts did not have a budget deficit in FY24, they still relied on their unassigned reserve fund balance to financially bridge the gap for district operating costs. This qualitative research has been super rich, and I have three quotes here that I'll quickly discuss and put into context as to why this data is important. And also, these quotes are a bit lengthy, so I won't read them all, but it was just so rich I couldn't leave it out. I wanted you all to get the fullness and the context of this and understand the gravity of adequate school funding directly from the staff on the ground who are in the districts, the chief financial officers. So the first quote is, remember during COVID, schools got an influx of money. The CFO says that some schools may have what seems like impressive cash flow, but again, that's an anomaly. It's not something um, you always see. Also, the Georgia's Financial Officers Association recommends up to 2 months of operating reserves. And this particular CFO says they prefer 3 months. A lot of CFOs prefer to have 3 months of operating expenses. She says this is no different than at home. So when we see these, what feels like inflated, unassigned reserve fund balances, what we hear directly from our CFOs is that this particular fund that they are pulling from throughout the year to make their monthly payroll is necessary up to at least 2 to 3 months, just for a good rule of thumb. Again, we have lifted this up many times over the last few years here at GBPI, but the State Health Benefit Plan is costing school districts so much money. One CFO says that one per paraprofessional with 5 years of experience, that particular individual benefits is around 103% in FY25 of their total salary. And FY26 is actually going to be closer to 140%. He goes on to say that they are anticipating signing an agreement with a contract service company to start moving forward with classified position hiring via contract versus hiring it as an employee. And he says this is a major concern for quality. But what other choice do they have? And that was really disheartening to hear. The last quote here that I'll touch on, HB 92 calls for changes in tax assessors, allowing residents an additional 45-day appeal extension, and the State Department issue a notice to school districts just this year that payments are going to be a little bit later because they're moving to a new system. So these are things that districts have to worry about. And it can be very difficult in those first few months in the beginning of the school year to make sure that school districts have what they need. So this is just a little bit of insight. There's a lot more where this comes from, and we are happy to share this data out, but we just wanted to talk directly to chief financial officers to hear from them on some of their challenges in their K-12 communities. Next slide, please. Now for the University System of Georgia, the budget here is $10.2 billion. It contains about $2 billion in federal funding. The state teaching portion for the USG is about $3.6 billion, up from about $3.4 billion in FY25. State general funds of about $3.3 billion, and this was allocated to USG's college and universities for student instruction. And then in FY26, allocation to USG's 26 institutions actually increased by 7% from last year. In the teaching highlights, I want to just emphasize here that there was about an $11 million increase for the teacher retirement system, about an $18 million increase for a funding formula correction for cost of living, $19 million for the employer share of health benefits, and then about $170 million for the 2.7 growth enrollment increase. Now, I just want to point out here that the University System of Georgia enrollment climbed this fall to an all-time record of 364,000 students. One important critical point that I want to make here is that when we consider these enrollment increases, it is important that we disaggregate this data to show the disproportionate gaps related to low-income students. The number of Pell Grant recipients enrolled in USG is declining at an alarming rate, and we must lift up this issue. As a matter of fact, in Georgia in 2014, there were 119,000 Pell Grant students enrolled in USG. In 2019, that number dropped to 108,000, and in 2024, now 102,000. Just in the last 10 years, USG has lost 17,000 Pell Grant eligible students. Next slide, please. You will also see here the lack of investment from the University System of Georgia in FY25. Um, we see here that the Georgia state appropriation was 19% less, totaling 56%. And the state budget is now trending downward as it's 1% less than last year. So this means that students must support the remainder of their college expenses through the amount that they pay through tuition and fees. And so we're, again, shifting that cost to the student, which makes it more difficult for students who are financially and racially marginalized to be able to afford college, public college here in Georgia. These are things that we need to be mindful of as we think about college affordability. Next slide, please. State appropriations decreased the time to degree amounts as well. As you can see amongst its peers, with the exception of Florida, Georgia spends the least amount per pupil for post-secondary education. Alabama spends around 38,000, Mississippi 34, South Carolina 28, and Georgia around 22,000. These are compounding barriers for students, and I'll talk a little bit more about that in just a moment when I speak about the education lottery program. Next slide, please. For technical education, the top highlights I want to recognize here for the FY 2026. And again, TCSG includes 22 colleges and 18 campuses. There's about 538 million, but approximately 440 million of that was reserved for technical education. We see $331,000 increase for the TRS system for employer contribution, and then about 33 million increase to reflect a 10.6% enrollment increase. Next slide, please. So that'll just segue us into how the technical college system, full-time equivalent enrollment and funding has remained flat, although the enrollment has increased. The funding for TCSG has continued to decrease. However, we see the amount of funding per student go up as the funding formula generally, we will hope to, see this funding go up as generally funding lags a little bit behind. So this will be important with the federal policies looming over Pell Grant program. And now our very last slide. And thank you all so much. You've been great sports here. I know this is a lot of information to cover, but I wanted to really touch on the unrestricted reserves here. At the end of FY 2024, the total education lottery reserves were about 2.4 billion and 779 million for the shortfall reserve. But there's about 1.6 billion in unrestricted reserves. Some of the main points I want to really point out here is that Georgia's ranked number 3 in the nation for student loan debt, and about 48% of our undergraduate students are Pell eligible. This is super important, and I really just want to leave you with these last couple of thoughts here. Georgia's a state where, again, merit scholarships are highly prioritized, and Georgia remains about one of 2 states that does not offer need-based financial aid. A solution to this issue can be found in our education lottery reserve, and don't you worry, we are doing the work and advocating. We even got a Senate resolution passed with the help of our partners to have a college affordability study committee to help improve this issue. And so this is something that we are working hard to ensure that need-based aid is a state-sponsored program that we are prioritizing here. I'll leave you with this final thought. Education is a cornerstone of our society. There's a sense of urgency to protect public education more than ever before. I really want to challenge you all and all of us to do our part to ensure that lawmakers are fully funding and equitably funding public education, early learning, K-12, and higher education in Georgia. Thank you all so much. I will now turn it over to Leah Chan, our Director of Health Justice.
Hi, good afternoon, everyone. Next slide.
Our state has three primary agencies focused on healthcare and public health. So, the Department of Behavioral Health and Developmental Disabilities um, operates state hospitals and provides community-based services to Georgians living with mental health conditions, substance use disorders, and intellectual or developmental disabilities. Department of Community Health administers our state Medicaid and Peach Care programs that provide healthcare coverage to folks with lower incomes. And the Department of Public Health operates programs focused on disease and injury prevention, health promotion, and health-related disaster response and preparedness. So Georgia plans to provide almost $7.7 billion in state funds for these three agencies. General fund appropriations account for about 90% of that, and other sources like tobacco settlement funds account for the remaining piece of state funds. So overall, state funds for these three agencies combined have increased by about 5% or $353 million over the original fiscal year 2025 budget. So if we had $10 to spend on our state's three primary health agencies in fiscal year 2026, 7 of those dollars would go to DCH, 2 of those dollars would go to Department of Behavioral Health and Developmental Disabilities, and less than 1 of those dollars goes to Department of Public Health. So overall, our state investment is in health is really oriented downstream to catching folks when they're already in crisis or already acutely ill. So we do have an opportunity in the future to really move further upstream, investing more in primary care, public health, and the services and supports that keep people and communities well and really keep our economy thriving. Next slide. So before I dig deeper into how our state is contributing funds to the three primary health agencies, I do want to note the importance of federal funding contributions as well. So the three primary health agencies expect to receive a combined almost $14 billion in federal support in fiscal year 2026. So about 1/4 of DBHDD's budget and about half of DCH and DPH's budgets are derived from federal sources. So most of the federal funds flowing to our state are federal matching funds for Medicaid, which come from the Department of Health and Human Services Centers for Medicare and Medicaid Services, also known as CMS. As you all know, Medicaid is a state-federal partnership, and the federal government pays about 66% of the cost for an enrollee's healthcare benefits. And as Stacy mentioned at the top, Medicaid is actually Georgia's largest single source of federal funding. So funds from CMS and from other Department of Health and Human Services agencies like the Substance Abuse and Mental Health Services Administration are the largest federal contributors to DBHDD's budget. And then the Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC, that comes from U.S. Department of Agriculture, is actually one of the largest sources of funding for Department of Public Health, along with other large grants from the Department of Health and Human Service agencies like Centers for Disease Control and Prevention here in Atlanta. So taken all together, we see that federal funds really play an outsized role in supporting things like healthcare coverage for low-income Georgians, community-based services for adults with intellectual and developmental disabilities, substance abuse prevention programs, and public health programs for infants and children like early intervention services and nutrition support, and for emergency preparedness. So as we watch changes unfold at the federal level through both budget reconciliation and the annual appropriations process, it's really important for us to bear in mind the impact that significant federal funding cuts will have on sort of shifting those costs to the state or forcing the state to make cuts to services and supports. Next slide. All right, so switching gears back to looking at state dollars. So the fiscal year 2026 budget provides the Department of Community Health with almost $5.6 billion in state funds. So that includes almost $4.8 billion in state general funds and about $756 million in tobacco settlement funds, ambulance provider fees, nursing home provider fees, and hospital provider fees. So the budget increases DCH's state funding by about $291 million, or a little less than 6% above the original fiscal year 2025 budget. So really the lion's share, about 94% of Department of Community Health's overall state funding is earmarked for Medicaid and Peach Care, which provide healthcare coverage to a little less than 2 million Georgians with lower incomes. So Medicaid, as many of you all know, cover children, pregnant women, pregnant and postpartum women, individuals with disabilities, older adults, some very low income parents and caregivers, as well as some low wage workers. Peach Care, on the other hand, covers a smaller number of children whose parents earn above the Medicaid threshold. So, taken together, the majority of Medicaid and Peach Care enrollees are actually children under the age of 19. However, as you can see on this slide, about 55% of fiscal year 2026 state funds for Medicaid and Peach Care support coverage for older adults and individual disabilities, covering everything from nursing home stays to copays. Next slide. So some additional themes are showing up in relation to the Department of Community Health's budget that I really want to name. So first, we've seen over the past several years a continued effort by the General Assembly, and in particular the House, to increase Medicaid reimbursement rates as part of the overall push to strengthen our public healthcare system and ensure access to high quality, affordable healthcare. So Medicaid reimbursement rates, which tend to be lower than than Medicare and commercial rates. So in Georgia, for example, Medicaid rates are only about 83% on average of Medicare rates. So the Department of Community Health fiscal year 2026 budget includes about $23 million in additional state funds to support provider rate increases. So the largest line items impact provider rate increases for emergency medical transportation, therapy for children with autism, newborn deliveries in rural counties, and primary care. So another theme that's emerging is the need to strengthen our state's eligibility and enrollment infrastructure, which is made up of primarily the technology system known as Gateway, and then our frontline DFACS caseworkers. So in Georgia, all public benefits from Medicaid to TANF rely on the same infrastructure. So weakness in the overall system creates problems across all programs and really compounds harm for families who may be accessing multiple programs in order to make ends meet. So the unwinding of the pandemic era Medicaid continuous eligibility policy and the launch of Georgia's Pathways to Coverage program really sort of highlighted and exacerbated longstanding weaknesses in the state's eligibility and enrollment infrastructure. And we really saw how our outdated technology could create issues for both applicants and state agency workers, generate unnecessary state costs and a lot of churn. So we see how in the AFY 2025 budget, the state has included about $35 million in state funds and forecasts the allocation of another $35 million in state funds in a future budget cycle for the Georgia Technology Authority that will support activities overseen by Department of Community Health to replace the current system known as Gateway. So it's important to note that Georgia Technology Authority can actually carry money over, and so they don't have to remit any unspent funds. And we will also get a federal match for this $35 million. And overall, it will go to fund a modernization effort that really represents an important step in a multi-year process towards simplifying the application and enrollment and renewal processes for Medicaid and other public benefits programs. Next slide. So the final theme I want to highlight related to the Department of Community Health's budget is our state's continued investment in the Pathways to Coverage program. So Georgia continues to have one of the highest uninsured rates in the country. And the burden of that uninsurance really falls heaviest on our state's rural communities and on Black and Latinx Georgians. So we also know that the high number of low-income adults who are uninsured or underinsured means that Georgians as a last resort are showing up in our state's emergency rooms requiring care, which then increases uncompensated care costs for hospitals and really puts pressure, particularly on the bottom line of our safety net hospitals. So Georgia is one of 10 states that has yet to fully expand Medicaid to low-income adults as designed under the Affordable Care Act, despite a majority of support for the measure among Georgia voters. So this disparity between what voters want and what policies have been enacted reflects in part sort of the imbalance of power in our state and a continued pattern of systematizing discriminatory policies. So instead of fully expanding Medicaid in July of 2023, our state launched the Pathways to Coverage program. So that program offers a new Medicaid option to low-income adults that allows them to see the doctor, fill prescriptions, get access to preventive care, very similar or pretty much the same as traditional Medicaid. However, to be eligible, they must work, go to school, volunteer, or do some other combination of qualifying activities for at least 80 hours per month. Under the current design, most enrollees also have to submit monthly documentation of their hours by, say, uploading a pay stub or a letter from a volunteer supervisor. So as of March of 2025, a total of almost $92 million has been spent on the Pathways to Coverage program, including about $16 million in state funds. So as you can see from the graph, the majority of total spending, about 56%, has gone to Gateway, which actually qualifies for a higher federal match, which is why you see a higher proportion of federal spending on it. So a majority of the total spending has gone to Gateway and other administrative expenses. So in other words, Georgia's federal and state taxpayers are spending more on upgrades to an outdated technology system than they are on actual healthcare benefits that allow people to see the doctor. And you can see how the investment in bureaucratic red tape is actually a barrier to both gaining and maintaining employment. As you can see highlighted here in the quote from an interview that we did with a Pathways enrollee about their yearly renewal process. So I'll just read part of it. So I was really confused because I was told by the state that there was no problem, but I was told by the other organization, which was the care management organization. The other organization was saying that there was a problem. I reapplied the day I got the renewal notification, and I didn't think anything of it. When I checked my account in January, the renewal was denied. Every time I called, they would tell me something different about why I was denied. So really encourage folks to go to Georgia's Pathways, georgiapathways.org to read the full story, to really get a sense of what folks go through as they are enrolling and renewing their Pathways to Coverage coverage. All right, next slide. Oh, and I do want to say this. So there are an estimated 240,000 Georgians who are potentially eligible for Pathways to Coverage, but only about 30,000 Georgians will be actively enrolled at full implementation based on the extension application that the state submitted for federal approval earlier this year. And because Pathways to Coverage does not qualify for the enhanced 90% match for states who expand coverage to adults earning up to 138% of the federal poverty level, Georgia is actually paying more per person and missing out on a lot of the downstream economic benefits. As just one example, between 112 and 285 million in additional state revenue, as estimated by our state auditor early this year. Okay, so the fiscal year 2025 budget increases DBHDD state funding by about net 59 million, which is a little less than 4% above the original fiscal year 2025 budget. And much of this increase is actually accounted for by reimbursement rate increases originally added in the fiscal year 2025 budget. So it annualizes those rate increases for providers that serve individuals with intellectual and developmental disabilities in their homes and communities, and for providers that deliver community-based preventative or rehabilitative services to individuals with mental health issues or substance use disorders. So if you look at the state funding for DBH overall, the largest state-funded programs fund evaluation and treatment, as well as institutional and community-based care for children, adolescents, and adults with either mental health issues or disabilities. Next slide. So the budget for Department of Public Health increases the state's funding by about $3 million, which is about less than a 1% increase above the original 2025 budget. Much of that increase is accounted for by an increase for the perinatal home visiting pilot project that was launched in fiscal year 2024. And so it will allow them to expand support to pregnant women and their infants in 75 total counties in Georgia. So looking at the state-funded programs overall, the largest state-funded programs support our 159 county health departments, provide services for children, and help track and prevent the spread of infectious diseases. Next slide. So, as we discussed earlier, rather than simply treating people who are very sick or already in crisis, investing more upstream and supporting community level change that give all Georgians a shot at good health can actually save money and save lives. So, one way to help get upstream is by investing in our state's public health infrastructure. So, we know that public health interventions like improved sanitation, access to family planning, were the most significant contributors to Americans leading longer, healthier lives in both the 20th and early 21st centuries. So data shows that increases in state public health spending have been shown to reduce preventable deaths, and that healthier communities actually support healthier economies. So over the past decade, we've seen more of a focus in the General Assembly on how we fund healthcare and less of a discussion around the ways in which we're funding our state and local public health system, a general outline of which you can see on this slide. Next slide. So this past session, the House passed H.R. 847, which actually establishes a study committee on public health funding. So this really represents a bright spot that can help bring greater attention to the value of state and local public health and really the need for sustained and hopefully in the future, increased state investment. As you can see from this slide, total per person funding for public health has actually decreased over the past decade, while rates of some of the leading causes of preventable early death are actually trending in the wrong direction. So placing intentional focus on our Department of Public Health funding offers the opportunity to sort of chart a new course for the future that can build on our current strengths and ensure that state and local public health has the resources it needs to ensure that all Georgians have a shot at good health. So with that, I'll pass it to my colleague, Ife Finch-Floyd.
Thanks, Leah. Hello again, everyone. And in these next set of slides, I'm going to talk about three different departments: the Department of Human Services, the Department of Labor, and the Georgia Department of Corrections. So let's start with DHS. Next slide, please. The Department of Human Services oversees various programs and services, including foster care and adoption services, child welfare services, support for low-income individuals or programs that support low-income individuals, aging services, and child support. The General Assembly included about $1.1 billion in federal fiscal year 2026, in the fiscal year 2026 budget. And that's about a 3% increase over and above fiscal year 2025. Next slide, please. So this is a breakdown of the shares of how DHS, the programs that comprise DHS, and how much money is going, or the share of how much money is going to those different programs and areas. And you can see more than 60% of the DHS budget is spent on child welfare services, foster care, and adoption services. The next highest level of DHS funding goes to those low-income support programs, and that includes the administration and the eligibility processing of programs like cash assistance or temporary assistance for needy families, nutrition assistance, also known as the Supplemental Nutrition Assistance Program. And again, it also administers or focuses on the eligibility processes for Medicaid as well. However, there's a growing body of research that suggests that economic support programs like TANF, like SNAP, like Medicaid and childcare and things of that nature support programs that help keep families stable, healthy, and also reduce their involvement with the child welfare system. However, we see that legislators didn't really include investments to bolster those programs. For example, our TANF program or cash assistance program has really I sometimes say withered on the vine since it started in the late 1990s, and now reaches a very small share of people who are potentially eligible. Only about 5 families access the TANF program out of every 100 who are in poverty. So that is an example of how poorly that program reaches people in need and families with children. And the state really has not invested in that program in decades. However, again, what the research is showing is that if we were to expand some of these public benefit programs and or make them more easily accessible, we could potentially lower the cost of the state's child welfare system. We see just in this graph, again, most of DHS's funding is going to the child welfare system and the foster care system. And now, just today, we know there's a lot going on at the federal level. There are changes that could make SNAP and Medicaid at risk for major cuts, further destabilizing families if those proposals are enacted. Next slide. So a lot of what is in the 2026 budget for DHS, again, focuses on child welfare and foster care services. In particular, there's $19.3 million for foster care to cover the growing cost of caring for children with complex needs. This issue really came to the fore around the hoteling, the hoteling issue that we saw in the past few years, where children with complex needs either had to leave their foster family's home or group home, and they had to be housed either in a hotel or a county DFACS office for their safety. And the state has worked really hard to try to reduce the number of children who are in these hoteling type of situations a night and has made significant progress on those efforts. But they realized that they needed additional resources from the state to make sure that they were supporting those children as necessary. Another piece I wanted to highlight is the $5.8 million for a $3,000 pay increase for the Division of Family and Children's Services, or DFACS, eligibility workers. I really wanted to highlight this because, one, it was a GBPI priority during the legislative session, and also in the FY 2025 budget, they were left out of this $3,000 pay bump. It went to frontline workers in the child welfare office and also in the child support office, but they were left out. But this is really important because the state has made major investments, particularly during Medicaid unwinding, to actually hire DFACS eligibility workers. And this pay increase will help support that hiring and support retention. Historically, DFACS eligibility workers have had high levels of turnover, and we need to continue to invest in those caseworkers so that we can have a strong and qualified DFACS staffing levels. Additionally, DFACS eligibility workers help people seeking assistance and access them more efficiently. Right now, the state is struggling to get clients their benefits in a timely manner. And this is due in large part because of a historical underinvestment in the agency and in staffing. The issue has gotten so bad that the state is under federal scrutiny on the SNAP timeliness issues and now has a corrective action plan that it is trying to work through. Additionally, legislators included in the state budget a request that DHS and DFACS explain what they are doing to address these timeliness issues. And I believe this report came out in June and was sent to legislators last month. So this is a critical issue that we will continue to monitor. Next slide, please. So Leah talked about how federal funding is critical when it comes to healthcare in Georgia. And Danny mentioned also it supports the DHS budget as well. So this is just a snapshot of the different sources of federal funding that support DHS. Some of them have not been itemized. So in other federal funds, a significant share of that is administrative dollars for the SNAP program, food stamp program, to administer that program. But we also see that the social services block grant provides about $56 million to the state and supports elder abuse prevention in DHS. And also supports different programs in the Department of Behavioral Health and Developmental Disabilities. There's $19 million in the Community Services Block Grant, and that helps fund 23 community action agencies and other entities in Georgia. And then these organizations provide services and supports to low-income community members. LIHEAP, the Low Income Housing Energy Assistance Program, provides $76 million to DHS and helps low-income Georgians afford high utility bills. However, there are some proposals, and this is outside of the large reconciliation that is currently being considered at the federal level. There have been other proposals to completely eliminate the Community Services Block Grant and LIHEAP. So this would be a major hit to the Department of Human Services and certainly to the communities that are helped by these funding streams. Next slide, please. Let's move on to the Department of Labor. The Georgia Department of Labor is an agency tasked with providing employment services for businesses and workers, workforce data, but most critically, it's tasked with maintaining the unemployment insurance system for people who lose their job through no fault of their own. Next slide. As Leah mentioned, that DHS and DCH are going through modernization. DOL is also going through modernization. And DOL's focus on modernization is to try to meet the evolving needs of workers and clients and their new needs for evolving and enhanced technology and better customer services as well. These ongoing adaptations require sustained investments, including state funding to support the fluctuation of federal dollars. So, for example, temporary federal relief funding from the American Rescue Plan provided some support to the Department of Labor to make modernization investments. However, again, that was temporary resources. And just this year, DOL asked for an additional $1 million from state legislators to support more personnel training and system modernization efforts. But we see that they did not really get that full amount, as we saw in the previous slide. However, DOL collects payroll taxes from employers, but those resources are not always funneled into the agency and instead goes to the Treasury. And DOL's chief financial officer noted in an appropriations hearing that the agency would likely collect about $30 million just in fiscal year 2025. But again, that's going to the state agency and not necessarily being funneled into DOL to help support these modernization efforts. Instead, state legislators have asked the agency to use funds it already has to do this, to fund these modernization efforts, including using existing resources, about $2 million from the unemployment insurance program to support these efforts. Next slide, please. You know what? Next slide. I think I went over. So let's just look at where we really should be when it comes to the unemployment insurance trust fund. Right now, we have about $1.8 billion in the UI trust fund, and it really should be at about $3.2 billion. But as I just mentioned, if we are using those resources or some of those resources to support modernization, we are actually not making the necessary investments that we need for our UI system. And this is a short-sighted approach. Next slide, please. The time to invest in our unemployment system is now when unemployment is low. Over the course of this year, there's been predictions of an economic downturn or a slowdown. So Georgia really needs to be ready for when that happens. Next slide, please. Moving on to the Department of Corrections. The legislature approved about $1.7 billion for the Georgia Department of Corrections budget. And we see that this has been growing over the past few years. Pardon me, just getting my notes together. This is nearly a $200 million higher than what we saw in the previous fiscal year. And this budget is a multi-year trend of rising prison spending, and the state's response to prison violence and human rights violations that was elevated by the U.S. Department of Justice report and a state legislative study committee. Next slide, please. So here are just a few of the budget highlights. There's certainly a lot more, but $50 million to support new infrastructure projects, technology and security improvements, $44 million for salary increases and job promotion changes, $43 million to boost marketing, training, and workforce retention efforts, and $31 million to expand prison health contracts for mental, dental, and physical and pharmacy services. Next slide, please. However, Georgia legislators really refuse to consider other critical health and well-being concerns or what is contributing to the rising prison population. More than half of the state's prison population is Black and therefore more likely to experience violence and those human rights violations that I noted earlier. Incarcerated Georgians and their support system, their families who are supporting them, carry layers of economic burdens that can erode efforts to maintain their health during incarceration. So, for example, people who are incarcerated tend to have worse health conditions and more disabilities than the general population. But despite more than $31 million added to the prison health contracts, there's no added spending to specifically address incarcerated Georgians' help with copays. So yes, people who are incarcerated actually have to pay health copays. They may range from $2 to $5 to $7, but if you have no income at all, you can't afford even that amount. And sometimes families, again, if they are able, help those who are incarcerated pay for these copays, but if they can. But if they cannot, they are unable to receive that adequate and timely care for their health conditions. Overcrowding of Georgia prisons has not led to a conversation about how to address the state's high level of incarceration. With the prison population dropped during the pandemic, it's now returning to its higher levels from the 2010s. Without state legislators having a constructive conversation and an evidence-based conversation about what contributes to our overcrowded prison system, like over-policing in Black communities and truth in sentencing policies, we're not going to be able to fully address the violence and harm within our prison system. So I'm going to turn it back over to Erin. If you have any questions, please put it in the question and answer box, and we are happy to address them as they come.